Good evening, Peter.
Good evening, Benji.
Now, we're asking everyone today on the show, what was your ultimate post-swimming snack as a child? What did you go for?
Well, I have a very sweet tooth, so I would always go for something like a Caramac, which your older listeners may have heard of. But I used to love a Caramac.
What, is that like a Curly Whirly without the chocolate?
It's kind of like just caramel, really.
Like a Dame bar?
Yeah, but excellent. I don't think you can buy them anymore, but hopefully they'll bring them back one day.
Well, there we go. The campaign starts here, Peter Taylor. No, we've had some brilliant responses. Some children got treated to, like, a Big Mac and an Aero. I was lucky if I got a bag of pickled onion Monster Munch, but I probably shared with my brother. Yes, the very spoilt listeners. No, I'm joking if you're listening at home. Right, let's get straight to it. Well, actually, we'll get on to COVID in just a second, but the Intu shopping centre has been the focus of many of our Ask the Mayor Monday sessions. Listeners will know. We've always been eager to know what's kind of moving in there, what's moving out. Intu obviously sold that centre, and it's been bought out. Talk to me a bit about that. Does that mean really it's not an Intu centre anymore? Where are we at?
That's right. So Intu, who ran 17 shopping centres, went into administration, but then there's like a separate legal entity which is Intu Watford, which wasn't in administration. So it's quite a complex legal situation. Obviously, the council has the freehold. Yeah. But the long and short of it is this is good news. It shows that there's lots of interest in our shopping centres. So it's one of the first ones that's been bought, and as we've said many times, it has done really well since lockdown finished. I was there on Saturday, and it was very, very busy, but people were following the rules. They were keeping the distances, wearing masks, using the sanitizers. So I think it's a good sign that this has happened, and I know many people are interested in what it will be called, because there's potential obviously that for the shopping centre to be renamed as well.
And are we going to launch a Boaty McBoatface type competition to rename the Intu Centre?
Well, I started a Twitter poll, or the Watford Lib Dems did a couple of days ago, and 83% of votes so far are to call it the Harlequin, which of course is what most people call it anyway, and never stopped calling it. So I think whoever does own the new shopping centre, it'd be a very easy win just to bring back the name that most people actually call it by anyway.
There's a certain amount of affection. I mean, we all saw that when John Lewis moved out. There was almost an outpouring of grief, and I think to rename it the Harlequin, or to just kind of acknowledge its name, would do a lot. Or we could try and be extra posh and call it the Broadway or the Boardwalk or something like that.
I think I prefer the Harlequin, definitely.
Yeah, all right, fine. Now, listen, of course, COVID, big topic that we talk about on our sessions. There is a big warning this week. It is serious. It's not. We're not. Our cases aren't like the rest of Hertfordshire. They are much more serious. We've got a small window. 101 people have tested positive for the virus in Watford over the last 7 days. How long have we got until we have to go into a new tier of restrictions?
Yeah, you're right, Benji, that it is, a window of opportunity. When I've been coming on here, for weeks and weeks, and every week I've been saying that cases are doing relatively well compared to the rest of the country. And so throughout August and September, it was kind of 20, possibly 30 people that would be testing positive for COVID in Watford. And as you say, the last 7 days, it's gone right up to 101. And so, this is a serious moment for the town. We've got to make sure that figure starts to come down. We're seeing most of the country now is in tier 2 or tier 3, which does, restrict what people can do. And if we want to stay at the lowest tier, then we've got to start reducing those numbers. So the big message for everyone listening to this is, please follow the rules. Please make sure you wear a mask, especially if you're indoors in a public space. Make sure you're keeping your distance from others, and of course washing your hands regularly. And if you think you might have COVID, if you've got the symptoms, so you try continuous cough, or you've lost the sense of taste or smell, then please get yourself tested. There's lots of testing sites that have been opened, because the last thing we need is people refusing to get tested and then going around and spreading the virus with people that they meet. So
how old? Sorry to interject, Peter. How old are these 101 people? Are they older? Are they younger? Does that not mean anything because young people aren't getting tested?
So the figure figures in Watford are really spread out amongst all age groups. So across the country, it's predominantly 17 to 24-year-olds. In Watford, it's right across every age bracket that we've seen an increase. And so, in a way, that's more dangerous because obviously the older residents are who contract the virus, the more serious it tends to be. And so that is a concern that we're seeing it right across all age groups. And we're saying, even if you're someone who's young and fit and healthy and thinking, well, it won't affect me, if you catch COVID, then you can spread it with friends, relatives and loved ones. And so it's important that we all follow the health advice, otherwise we could be spreading it to other people.
And just before I let you go, in about 20 minutes we're going to be talking to Watford Football Club. Any plans to reopen that stadium for use by the local NHS hospital? Because we know just how much that really alleviated the pressure on West Herts Hospital, also known as Watford General.
That's right. I mean, they did an absolutely fantastic job in the spring, and huge credit to the football club for what they did. I know that the number of cases at Watford General are rising. I'm sure that'll be a discussion that's happening between the football club and the hospital. But obviously, pay tribute to what they did in the past, and I know that the football club will be eager to support the hospital if that's necessary again.
Brilliant. Thank you very much, Peter.